We're here to announce our deal with Aurora. It is one of the biggest deals we've ever done in the history of this company. This is an 8-year deal, and the focus is going to be on research, safety, and the health and well-being of our athletes. We hear that a lot of these guys and girls, we hear that a lot of these guys and girls are using CBD products, and this is a way for us and them to learn more about it. There's going to be a lot of research. Obviously, the PI is going to be very involved in this too, and what better way to learn than from the experts? Aurora is the biggest and the baddest in this business, and we're excited about it. We look forward to it, and thanks for coming today. I'm going to leave it to the people who know what they're talking about here, but we're very excited about this deal, and we've been talking for a while here. I think on both sides, we're both pretty pumped. So thanks for coming today, and thanks for being a part of this.
Terry? Thanks, Dana. My name is Terry Booth. I'm the CEO of Aurora Cannabis. We are a Canadian company that has been at this for the last 6 years. We pride ourselves on quality control and governance and performance. We've executed in many ways across this globe. We're now in 24 countries providing cannabis or other services related to it. We're one of the biggest, for sure, producers. Our footprint is the largest globally. We started in 2013 to provide patients access to high-quality medicine, which our federal government allowed in 2001, medical cannabis. As you know, Canada also has an adult usage system that just kicked off in October. We're fully integrated, operating in all segments of the sector, leading the world with expertise and everything from state-of-the-art production facilities. As you saw, that was our Sky facility on the video. And it's helping people have access to this medicine that is plant-derived, that has been a medicine for over 5,000 years. Our production philosophy is simple, but it's also complex. We grow the best high-quality cannabis in the world. The consistency of our strains allows us to do the medical research that allows our physicians comfort when they prescribe it. Very important that you keep the science in the cannabis, and we will have Jason speak to that a bit later. We employ close to 3,000 people now, and that's happened at a very rapid pace. It's been a fun 6 years, probably taken 6 years off my life. Let me tell you why we decided to partner with the UFC. And I'm a boxer, which I was never any good. But when I went to that Performance Institute and I saw what these athletes have access to and what these athletes are committed to in their recovery, in their training, and in their fight prep, unbelievable compared to the boxing industry. You're miles ahead. And I think it's going to set the standard for all sports, what they do at the Performance Institute. We're starting with the research on this. This isn't going to be a quick project on CBD, cannabidiol. It's one of the most prolific molecules in the cannabis plant. It is an anti-inflammatory. It helps with all kinds of great things. Again, I'll let Jason speak to that. He's our medical guy. The research, the brand building, and product development are all part of Aurora's move into the U.S. market. And in collaboration with the UFC, we intend to play a major role in the U.S. cannabis market. This is the first partnership of its kind, where we have the ability to work with active athletes in the prime of their careers to develop a product that can address some of the stresses that come with competing in such a physical, high-performance sport. What we're doing will not only work to help athletes, but also educate the public and policymakers on the potential benefits of CBD derived from hemp. A great act that the U.S. government approved, the Farm Act, which allowed for the growth of hemp in this country. It's going to employ a lot of people, and it's going to help a lot of people have better days. Thanks. Jason?
Hi, my name is Jason Dyke. I'm the chair of the Global Science Oversight Committee for Aurora. So it's my pleasure today to announce the research partnership between Aurora and the UFC. We know, I think from discussions with our colleagues and coming down to the UFC a few times, we know that a number of your athletes or the UFC athletes are requesting information for CBD-derived products. I think it's, the lack of evidence out there makes it difficult for the UFC to give proper guidance. So that's exactly where Aurora will step in. We will provide the medical evidence that's needed. We will study patients or athletes, have an intake form, understanding what they're currently using, what their ailments are, if they are using a CBD product. We'll refine that research so we'll know if it's safe, efficacious, and safe also refers to within the guidelines, regulatory guidelines of USADA and water rules. So we'll be able to provide clear evidence that will help guide the UFC to inform their athletes about what best product to make or to use. We'll also then, during that research, we'll also develop products. So we'll learn from, it'll be an iterative process of the product development aligning with the medical research. We'll be able to find out which products are working, which ones might work for certain indications such as pain, inflammation, recovery, wound healing. I think those are top on the list right now. So I guess today really is to officially launch our research program. We have the intake forms all ready to go, or we will be in a couple weeks. We'll roll that out with partnership with the UFC to the athletes. We're looking for volunteers within the UFC roster of athletes. We would hope all with 508 on the active athletes on the roster would participate. I know just from meeting a few of the athletes, they seem extremely interested and want to be, have approached me and want to be a part of this study. So I don't think that's going to be a difficult recruitment process. And at the end of the day, we're looking to make, again, evidence-based research on CBD products and trying to understand how best to help athletes recover and deal with the dramatic insult that we see some of them suffer, and whether it be training or the actual fight. So overall, I guess our research products will improve the overall health of the UFC fighters and hope leading to all of them living better days. So.
Duncan?
Thank you. I'm Dr. Duncan French. I'm the Vice President of Performance for the UFC Performance Institute. I think from day one, just over 2 years now, the mandate of the UFC Performance Institute set forth by Dana and the rest of the executive board, the executive team, was to be leaders, true leaders in high performance, health and well-being of professional athletes. And on a daily basis, we obviously strive to do that. We've been open for 2 years now, and we've really engaged with our roster of 580 fighters. And we've really collected a lot of insight, anecdotal at this moment in time, to understand what the fighters are doing using CBD type products as a mechanism to support their performance and their well-being. As our mandate, we obviously are interested in taking that on and challenging it to better understand it, and as Jason has contested to obviously give clinical efficacy to the approaches. So often it's, what informs the practice? Is it the invention and the innovation of a professional athlete, or does the science lead an approach that the athlete then engages with? And that's clearly what we're about at the Performance Institute. So we're very excited about this research opportunity. It's going to be split into 2 phases initially. As Jason has contested to, phase 1 is very much going to be about understanding the landscape for our athlete population, to really understand usage and types of products, etc. There's going to be no product involved in phase 1. It's going to be very much about collecting insights and information. Phase 2, as we roll out more of the research initiatives, we'll be then looking to interrogate and analyze that data to then be able to look at this heterogeneous population of athletes and understand how we can best formulate product off the back of our initial understanding. So clearly, to begin with, it's very much about insights and understanding how athletes on our roster are using CBD products, largely for recovery from fights and from practice, pain management, wound healing. We've got a lot of anecdotal reports that's the primary uses. So it's going to be very much around topical creams and ointments to begin with. There'll be no oral administration to begin with, so that we comply with regulatory requirements around CBD. And again, that's largely where a lot of the usage in our population is coming from. So we look to, as I say, create clinical efficacy for what our fighters are doing on a day-to-day basis. We're very excited. We've already had over 30 of the fighters reach out to us to look to engage in this type of research once the initiative was announced with Aurora. So there's definitely a lot of traction and interest from our athlete population. So we're excited at the Performance Institute to be engaging in a partnership with someone like Aurora that really puts science and evidence at the forefront of their approach. And again, that dovetails exactly with what we do at the Performance Institute. So very excited about the opportunity to again put the UFC at the forefront of leading, understanding how we can support professional athletes on a wider scale using something like CBD.
Jeff?
Good afternoon. My name is Jeff Novitzky. I'm the Senior Vice President of Athlete Health and Performance with the UFC. As many of you know, my main role at the UFC is overseeing our professional sports leading anti-doping program, which is independently administered by the United States Anti-Doping Agency, or USADA. First off, I'd like to clarify the rules regarding CBD use under the UFC Anti-Doping Program and the various state athletic commissions where athletes compete. The UFC Anti-Doping Program follows the World Anti-Doping Agency, or WADA, prohibited list, and on January 1st, 2018, CBD was removed altogether from the WADA prohibited list, making its use completely legal at all times for our athletes under our program. Our athletes must also adhere to rules of the various state and national athletic commissions where we hold events, and for the most part, most of the state and national athletic commissions follow the WADA prohibited list. So in those jurisdictions, CBD is allowed at all times as well. However, there are still a few athletic commissions, particularly Illinois, Wisconsin, and Michigan, that still have a no tolerance policy for CBD. And as we already do and what we will continue to do, as soon as we find out any of our athletes are scheduled to compete in an event in those jurisdictions, we alert them to the differences in the rules. And indeed, we just experienced this at UFC 238 in Chicago, Illinois, and all drug testing conducted by the Illinois Commission in the run-up to that event and at the event resulted in no issues for any of our athletes competing there. Also, as we already do and will continue to do, we are educating and lobbying those athletic commissions to look at the science, to look at the research already conducted by WADA in taking CBD off the prohibited list, and hoping to get them in a compliance, with the rest of the anti-doping world. A major part of my job is interacting with our athletes, getting to know them, texting them, calling them, emailing them, and asking them questions about supplements they use and other substances. And in my conversations with UFC athletes in their camps, I believe, at least anecdotally, it's possible that more than half of our athletes currently use CBD products. I'm told by our athletes that they use them for the various things that were talked about up here already: pain relief, anti-inflammatory purposes, sleep aids, and anti-anxiety properties. And because of this information that I've learned from our athletes is why it's so important that the UFC be leaders in educating our athletes on CBD use and being leaders in taking part in clinical studies like this and studying the effects of CBD use to see what health and safety benefits it may provide to our athletes. Lastly, and perhaps most importantly in my world, is the safety of CBD products that our athletes use. Whether the product has the advertised dosage of CBD in it, whether it truly contains less than 0.03% THC, the psychoactive ingredient in cannabis, and whether or not it's free from pesticides, heavy metals, or any other prohibited substances under the WADA list. This is as important as it gets in my world and in relation to the careers of our UFC athletes. Drug testing sensitivity over the last several years has increased anywhere from 100 to 1,000 fold. And anti-doping laboratories throughout the world now have the ability to detect prohibited substances in extremely, extremely low quantities. Picogram levels are parts per trillion. Aurora already has a robust third-party testing program to ensure the product's potency, label accuracy, and absence from contaminants. They have assured us that the testing on any products that we give to UFC athletes will include testing against the WADA prohibited list and prohibited substances. And for those reasons, I believe the products Aurora is going to produce for our athletes and in this study will be amongst the safest products in the market in the world. And in my world, safety and quality standards like those possessed by Aurora really let me sleep at night. Athlete health and safety is a top priority for the UFC, and I cannot be more excited and pleased to collaborate with Aurora to make sure that we provide our athletes with the absolute safest CBD products on the market.
Great. I'm Darren Karasuk, Chief Commercial Officer with Aurora. As Terry and Jason have mentioned, the clinical research part of our work with the UFC is going to be driving the product innovation for our hemp-derived CBD products. But another exciting part of what we're talking about here is the announcement of our brand for doing such, Roar Sports. And Roar Sports will be Aurora's flagship performance sports brand in the United States. The product portfolio will be exclusively 100% hemp-derived CBD products that are also 100% backed by science, the first. Together with the UFC and in conjunction with their state-of-the-art performance institute just up the road there, we'll be working directly with the roster of high-performance, high-caliber athletes to develop a product portfolio that's based on the findings of both the clinical and the scientific research. The mission with this brand really is to cut through the noise. Excuse me. And there's very few better ways to cut through the noise than with a loud roar, if you will. But part of this is to create products that are going to create efficacious, reliable, and clean products for professional athletes, but also for amateur athletes and for those that are more fitness-minded, searching to achieve their particular goals and help them achieve those. When we do enter the marketplace with our product, we know that it's going to be ripe with competition, flooded with untested products making unwarranted claims. And one of our key points, if not the key points of differentiation in that marketplace are the fact that our products are going to be based on science and based on research. And in addition to that, are going to be the official CBD products of the UFC and have the UFC PI seal of approval to help give consumers and athletes greater sense of confidence in what they're doing to help achieve their best.
The panel will now take questions from the media. I believe we're going to start with John Morgan from MMA Junkie back there.
Yeah, thanks, guys. I'm not sure who would be best to answer the question, but you said an 8-year partnership. I'm curious what the timeline will be for developing products. You know, these phases. What kind of timeline will it be before you have these products available?
Yeah, so essentially, once we gather the necessary information from the athletes, what they're using and for what indications, we'll be able to then so that program will be started immediately. And once we learn from there, that will guide our product development. And so we're looking at a very short term, maybe not launch of a product, but development of a product that can be tested in-house and back into the athletes for efficacy and safety. So once those, I suspect over a period of this 8-year partnership, those products will be refined and improved upon, and we hope to be able to target them for specific indications. And so this is again an iterative process, hard to predict, but we'll start immediately in the recruitment, and we'll start within 6 months or so have products to be tested in athletes.
As far as athlete participation goes, I mean, obviously this is something that would benefit them, but they're kind of the guinea pigs as well, I guess, right? I mean, is there any, what's in it for them in the short term? I mean, is it free product? Is it compensation? What's in it for them to sign up to be a part of this?
Well, I believe that since being approached by some of the fighters, they anecdotal evidence that they're finding online or small clinical studies that they may have heard about and word of mouth they want and are desperate for this information. And so I would be shocked if we don't have a very good enrollment rate. As far as compensation goes, that's would be, that kind of is a breach of any of the REB approval for ethics approval for these clinical studies. But there's certainly products will be provided to them for testing. So, again, we're going to make sure they're safe products before they even enter man or women. But they will be, for sure, they'll be part of. I like, instead of guinea pigs, as you said, I would like to see the UFC fighters maybe labeled as our partners in research.
And last thing for me, can you give us an idea of what kind of products maybe?
They're saying, is this working? What they're saying is over 50% of the fighters are using this stuff already, right? What are they using? What's in it? Blah, 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 blah. These guys are going to create stuff that's better, safer, etc. So why would they not want to be a part of it? Of course they're going to want to be a part of it.
Just that mine's on either. But we have the FDA recently saying that they're going to expedite their approval or disapproval of an ingestible CBD derived from hemp. That's a very good sign. The World Health Organization supports the safety of CBD, and when you have a company like Aurora in partner with the UFC creating it and testing it to a very high standard, we call it the Aurora standard, it'll be a product that's safe and accepted. Right now, the athletes, as Dana said, are buying it off a shelf. They don't know what's in there. They don't know if it's been tested. So we're getting back on track with a safe product.
And so just last thing for me, I mean, you might have just touched on it a little bit there. I know there's probably trade secrets and strategies and all that involved, but can you give us an idea, like what the future holds and what type of products we're talking about? What do we believe can be achieved through this?
It's an incredible industry that I've been involved with for the last 6 years, and seeing the product development on all ends of the cannabis spectrum continue to develop. I mean, there's transdermal, there's tinctures, there's mints, there's gums, there's sprays. A whole line of different products can come from this very safe molecule, the cannabidiol. And I think that the future of CBD globally is massive. It's a massive market for not only recovery and repair, but also for sleep, for anxiety, and that helps the athletes as well.
First question is for Mr. Novitzky. You mentioned there are 3 states, at least 3 states, that are still against using CBD products. To my knowledge, though, CBD is not detectable in a drug screen. Is that correct?
I'm not aware of any, certainly USADA doesn't, and of any athletic commissions that do test for it, despite being against the rules, but I have confirmed through scientists in the anti-doping world that there is a test available should they want to use it.
And you admit, we know we're talking about CBD that's derived from hemp, which is, to the layperson, cannabis is synonymous with marijuana, and of course it's not. Marijuana and hemp are 2 different things, both happen to be cannabis. But since we're in a state where THC is legal and the commissions are state governed, I mean, is there ever a possibility the states would just, allow THC as well?
I mean, I've had conversations with the Nevada Commission about that, so it is potential, I would guess.
Well, I'm glad to hear that. The last question I have about the commissions in those other states that don't allow for CBD, do you think that UFC will be able to possibly influence them to change their stance?
Well, certainly we're going about it the right way here, is conducting that research, and any recommendations we make are going to be research and science-based, and to us, that's the only way to do it.
Thank you. And just a few questions for Dr. Dyke. Can you tell us a little bit of your background in scientific research with medicine?
Yeah, sure. So I'm a professor at the University of Alberta for 20 years. So I run a large research program there, my own independent program. I also run a cardiovascular research center. So I direct that as well. So I've had a lot of experience from fundamental basic research all the way through clinical trials. And so, I'd say about a decade ago, I started working on plants as medicine, focusing on resveratrol, which is not germane to this press release, but from that seemed to be an easy fit to be able to see cannabis and the ingredients in cannabis as being a true and validated medicine. So that's how I I got into cannabis research specifically.
Sounds like you're definitely the guy for the job. You mentioned earlier that, and I know this because I'm a cannabis investor, there's not a lot of research on cannabis out there. There's not a lot of good scientific research. So you're taking on a very, very difficult task and a very expensive one. My question, I guess, for you and Dana and Mr. Booth, who's paying for all the research? Because it's going to cost a lot of money to do.
Well,
We're all looking at each other.
so I mean, paying for it aside, because those are for these individuals to discuss and to comment on. But it is a challenging task. But this is what's absolutely needed in this industry. I mean, in the cannabis world, is to provide valid clinical evidence. And so, as the leader in the industry, I think it's incumbent upon us to do that research. And so, we don't do things because they're easy.
Yeah, just to add to Jason, cannabis has been tested for its adverse effects since 1961 and thoroughly tested. And there wasn't a lot of bad reports that came out with respect to that testing over the last 50 years. Over the last 6 years, there's been a significant amount of testing of the molecules in cannabis. And there's more than just anecdotal evidence that supports what CBD does. There's proven evidence on the anti-inflammatory effects of CBD. That's already been done. It's already been studied. But how the athlete takes it up, and what's the best way to deliver it, and what's the best combination of cannabinoids in that topical at this point, is going to be very important. And that's really a big part of this research is how does it get taken up by that athlete? What's the retention? When is it dissipated? When do they need more? That's the first phase. So it's not that hard of research. These guys are smart. We have 40 PhDs and 5 MSCs on staff that are studying not only human effects of cannabis, but also plant PhDs. So we're backed by a very, very strong science team. I think the strongest in the world with respect to cannabis.
So Terry said he's paying for it.
Appreciate the time today, gentlemen. First question for Jeff and perhaps Duncan as well. The first time, at least for me, the first time I can remember this conversation even entering the MMA sphere was Nate Diaz at the 202 post-presser. And at that time, I remember nobody really kind of understood what he was talking about. Is that sort of the genesis, if we trace it all back? Like, is this where this conversation started for you guys?
Not really. I mean, it definitely came about to the attention of the MMA world when he was doing that. But really, what that related to was the status that he sat on that stage and was vaping the CBD. Technically, under our anti-doping program, he was still in competition status, and at that period of time, CBD was not allowed in competition. What we looked at there, though, is he had just provided a post-fight drug sample, so they had his urine to show what was in his system when he fought. And what we realized was it was not fair to him that he was still in that in-competition setting, because the lab would be able to tell what was in his body when he competed. But it did definitely bring about attention to, I think, athletes using CBD, because I certainly didn't hear much discussion about it before then.
So I guess, there we go. So for the UFC itself, what's the education process been like over the last couple of years as you've reached something like this, where I feel like this is a pretty big deal, a major sports organization getting in bed with something like that?
Well, for me, it's just a blessing now to be able to sit with these experts up here, because it's a very common question I get about CBD products. Athletes are contacting me saying, hey, how do I make sure this company's good, that the product is safe, that it has in it what says it's on the label? And until this partnership with Aurora, it was difficult to do that. There's not, unfortunately, unlike the dietary supplement industry, where you have third-party certified supplements out there that third-party companies are verifying are safe, you don't necessarily have that in the CBD world. Aurora has a lot of that already, and it's going to get even better, so it makes my world a whole bunch easier.
I think there's still like a stigma around CBD and marijuana to some degree, and I wonder, was there a hesitation for the UFC to do something like this, to take this step forward? Is that a wall that you guys kind of had to try to break down internally?
Yeah, I think that, if you look at us and what we've done, what we continue to do, we're always at the forefront of what's next. How do you take the sport to the next level? How do you take the athletes to the next level? And CBD is here to stay. I mean, It's not going anywhere. And as usual, we're diving in head first with the biggest, the best in the world. And it's driving me crazy when Morgan said guinea pigs. It's the exact. I'm going to choke you later when I see it. It's the exact opposite. I mean, when you think about these fighters and they're out there going to these places and taking something, that's when they're guinea pigs. These guys are actually, the science and the everything, all the money that Terry's going to put into this testing, and it's all good for the athletes. This is an incredible opportunity for the sport, for the athletes, and I guarantee you, we're going to be first, and then you're going to see lots of other sports diving in behind us.
Part of my speech here, I forgot to mention, both companies know what it's like to have to change perceptions and break the mold in the way things are done. The history of the UFC, the fighters, man, they've made this amazing sport with the high level of professionalism. You have global phenomenon sport with highly trained athletes. We've gone through the same stigma, the same challenges in many countries, but now those health ministers are calling us, they're calling Aurora, right? So when you can become the partner of choice globally on the science of cannabis, I'm pretty proud of what Aurora's accomplished. In fact, I'm humbled by it. Today is the smallest the cannabis industry will ever be. Today is. So we're looking forward to continue this growth at the UFC.
Can I just follow on from Dana's comments again, just anecdotally from our canvassing with the Performance Institute, again, just referring to the amount of different use cases that athletes on our roster use CBD products for, post-fight lacerations and using CBD products to reduce the time it takes to heal those lacerations, the removal of bruising, day-to-day pain relief, anxiety and sleep effects that Jeff was talking about previously. So, we're navigating around the recreational piece, and it's very much around the health, well-being, and the performance of these fighters, and that's why we're excited to look at this as a potential mechanism to promote that. So, again, in the last 2 years, when we've been speaking with fighters via the Performance Institute, but obviously prior to that, with Jeff as a solo, mission as a UFC. On the anti-doping side, we're seeing those uses, and that's obviously what we're trying to do, is understand how can we rationalize that and how can we give best product that is a safe product that the athletes can see real kudos and credence to.
Just a couple questions then about the actual study itself. Perhaps maybe Jason and Duncan. What was going into the study? What does the actual study entail? Is it just the athletes using the products and then reporting what the effects, or is it a little more in depth than that? Can you kind of explain?
Yeah, again, it's going to be largely self-reported evidence based on their clinically valid measures that have been used in many clinical trials for whether it be sleep, pain, anxiety, and so forth. So clinically valid questionnaires, and it will be, and in smaller pilot studies will be performed, we would hope, at the PI, or it will be performed at the PI, and we'll be able to then do these small clinical trials and be able to understand, have a direct readout whether there's we draw blood and measure some biomarkers to strengthen the self-reported outcomes.
Yeah, I mean, just as a follow-up, that's the first iteration. Right now, we have no visibility outside of anecdotal evidence of what the landscape looks like for our athlete population. So to canvass that and to truly understand, the landscape and the status quo is huge to then make the decisions of how the research moves forwards beyond that. Now, I think, as I've already contested to, the second step is to look at formulations in a very heterogeneous way in terms of we've got different weight classes, we've got males, we've got females, we've got lots of different issues around pain management or lacerations or abrasions, like what is it we're actually going after? And these guys are the experts in developing those formulations. But this is also an 8-year partnership where the potential regulatory landscape will change. So it's impossible to answer that question in terms of where will this go to, because right now we're obviously navigating within Jeff's remit of regulation and Aurora's remit of regulation globally. But we've got very clear initial steps of where we want to go. And then beyond that, hopefully, the landscape changes.
And I guess my final question, and perhaps this is maybe too forward focused to actually have an answer, but what's the UFC's ultimate end game with the studies and the findings that would come from these studies? Like, what is it that ultimately you would hope to gain from all of this and use it for?
I think that's the same for all of us on the panel. Ultimately, we want to understand and give validation and credibility to this molecule of CBD and look at how it can support athletic populations. Now, on a weekly, monthly basis, I get calls from colleagues in other leagues and organisations around the world asking what's our position stance on the use of CBD in our athlete population. So I think as we become clearer about its impact on performance, health and well-being as we're talking about, it will gain, it will snowball. And I think that's what the UFC and Dana obviously can talk to this, but that's what we're about. We're about, pushing the boundaries, being innovative, with the influence on our roster and giving our fighters the best opportunity to succeed.
And initially, it's research on accelerated recovery, which by the way is acronym for Aurora. But that is really where this is starting, accelerated recovery. After that, these docs will get into all the other things that fighters need with respect to training, anti-inflam, recovery. Even when you're training, you might pull a muscle. So that's really the initial, is the research on accelerated recovery. After that, we're just going to get even more in depth.
Yeah, when the research tells you that over half the roster is already using it, it's a no-brainer. It's something we have to look into and take seriously. And with the research these guys are going to do, it only helps. And at least when the fighter's done, Novitzky can tell you better than me. I mean, how many situations we've had where people will walk in, our fighters will go into a drugstore, and buy something off the shelf and test positive for something, that won't happen here.
Terry, if I can ask you a question, you guys were talking about, well, even like half the roster was using this. It got me thinking about the NFL. Has any other professional sports leagues contacted you to say, hey, we want to, and who has that been?
I think we have an arrangement with the CFL, the Canadian Football League, the Players Association there. NFL, as you know, have announced that they're going to their own internal work with each and every team. So each and every team is responsible for its own team. So there's no big study happening there just yet. The beauty of the UFC is these athletes are always in training, they're always in fighting. The seasonality of other sports leagues puts a big gap in that study. They might go and eat Cheetos and chips for 3 months and totally change their physical makeup when these tests are one after another. These athletes in the UFC are always in top shape. But yes, we've been, to answer your question, absolutely. And NHLPA has also gone into looking into the CBDs. The soccer league, the big soccer league, I forget what it's called, EU soccer, have inquired. But the UFC, we're way ahead of that already with this partnership. So, first movers, front runners, top teams that we're seeing happening here.
Dana, it does seem like you're always in the forefront of this kind of stuff. If you had Manfred, Bettman, and Goodell, and who might miss one of those, if you were in a room with them, wouldn't you plead with those guys, hey, you got to take care of your athletes?
If I got a room with what?
Wouldn't you plead with these guys, hey, take care of your athletes like you guys do?
Those guys always, they run the businesses and are completely different to us. From things like this to social media. We were the first in on social too. Just this is what we do, man. We want to continue, especially if you look at how far we've come in doing the research and safety stuff, whether it's with the Ruvo Clinic for brain injuries, the stuff that they're doing over at the PI now CBD. This is what we're striving to do. We're striving to be the biggest and the best when it comes to athlete health and safety. So and taking the sport to the next level in every way possible. It's what we have always and always will strive to do.
My question is more so for Duncan. Here you go, bud. For people who are like the layman who don't know so much about CBD and how it's taken in, you said orally is not something that the athletes are going to be using this more for massages or on the skin and lacerations and
Yeah.
sort of pills or anything like that?
I'll just give a quick intro, then I'll pass this off to Jeff because he can talk very much around the regulations. But yeah, the initial piece of the research is going to be very much around topical creams and ointments because that fits within the current FDA regulations of how CBD can be used. So Jeff can answer more on that question around the specifics.
Yeah, my most recent career before coming here, I was a special agent with the FDA, who now CBD falls squarely on their shoulders. And they have indicated pretty clearly that as a topical or a cosmetic, it is a legal substance here in the States, and the Aurora guys can chime in, but it appears to be a pretty clear path forward in the very near future to being able to regulate and legalize ingestibles or things taken in through the mouth.
You're not able to vape or smoke CBD, are you?
Again, right now, as the legal status here in the U.S., the only legal method of application is a topical or on the skin. And again, feel free to chime in. I think
That's a great question with respect to vapes. Aurora is the first company in the world to have a legal CBD vape, federally approved in Canada. Not yet federally approved in the USA, but we don't think it's too far away.
I'm just curious about, here in the back, I'm just curious about the approach involving other countries, like Brazil, where you have a lot of UFC fighters, but also CBD is a very controlled substance. Are you guys planning on trying to educate and help the countries to approach also the research and the information you guys have?
That's pretty well most of my job is talking to other countries and having our experts educate them with respect to the safety of not only CBD but also cannabis in medicine. So it's one country at a time. I never expected this many countries at this point in time. It's been very hectic in dealing with the countries that are taking on CBD and medical cannabis. But we've got the right team to do that, obviously. We're in, I could rattle off the countries, I'll probably miss 10. But we're a very busy company that has a footprint of our employees in all those countries. It's not contracts. These are our offices, our people in Germany, Poland, France, England, South America. We're in Uruguay. We're in Mexico. We're talking to Brazil. It's an amazingly fast-moving segment of cannabis is the CBD craze, if you will. But you know why? It's because it works. Okay, this wouldn't have got this type of traction if this molecule didn't work on recovery, didn't work on anxiety, didn't work on rest. Okay, it works. So we're just going to make some stuff that works real well and meets all the regulations.
And I think the partnership between these two companies will help a lot too, because you got guys like Novitzky and Ratner who can talk to the Athletic Commission in Brazil. They can talk to the Athletic Commission in Australia and all the other countries that we go to year-round, because these fighters will be fighting, and if they're using CBD, I think these guys can open the doors in these different countries. Once the Athletic Commission approves it, you're halfway there.
We just recently ran into two scenarios. Florida and Texas, within the last year or two, were no-tolerance states for CBD and THC, and both of them took, I think partly because of our lobbying, took CBD off the prohibited list and put the threshold standard of 150 nanograms for THC, which is the WADA standard, into place. So two, success stories there in recent years.
Actually, my question is for Jeff. In polling the athletes, have you talked to any who decided not to use the product, and do they have any problems with actually competing against athletes who do?
So the first part of that question again?
Have you spoken with any athletes who are kind of anti-CBD?
No, other than not being able to give them an answer and direction on a safe product. So many of our athletes are, and rightly so, very conservative about what they use, because they've seen instances in the course of our program where when you're detecting down to parts per trillion, you better make sure everything that you ingest is safe. So my inability to give an answer of having a safe product out there, I think, has prevented a lot of athletes from using, but now I think that problem is solved. And no, again, a lot of this is anecdotal, but I think, the health and recovery benefits aren't on a level of a hormone or something else where you're going to get, a huge
advantage or athletic benefit. This is more for recovery and health.
We have time for 2 more questions.
Do you foresee any new products coming out of all this research? And also for Dana, do you see UFC actually working with Aurora on creating new products and helping promote, sell, market new products?
Absolutely. Without a doubt, I hope that this leads to a number of products. The contract itself speaks to the types of products. The confidential stuff, we don't have that in the public markets yet, and the publicly traded, so I can watch what I say. See my CFO is cursing me right now. But product development is a big part of this, and the UFC's partners that have products and the retail partnerships and the channels of distribution that they've already set up, once we have the products, it's going to work to our advantage in a big way. And that's the goal, is to get this into the hands of everybody in the world.
What would be kind of typical examples of the products that could come out of this?
I would say a CBD vape pen, eventually. Right? I definitely see ingestibles, gum, patches, sprays, tinctures. With the we always say topicals. Each topical is a little bit different. One might be used to fix a cut, and the other might be a deep body rub that we want to have deep penetration into the beyond the skin and into the muscles. I shouldn't be talking science here, but we all have this thing called an endocannabinoid system within us, and that was only really discovered in the late 90s. These are cannabinoids. They weren't named cannabinoids because of the endocannabinoid system. They were named cannabinoids because that's the molecule that comes from the cannabis plant. So it is something that everybody can benefit from the use of cannabis, in my opinion. On the use of CBD, definitely it's a worldwide phenomenon that's going on here.
Dana, do you see lending the UFC name to the new products?
We have a partnership with these guys for 8 years, and obviously with the research that they're going to do and the products they come out with, if it works for the best conditioned athletes, the hardest training athletes in the world, imagine what it'll do for regular people like us. I'm sure it's going to be great, yeah.
We just also, the products will have UFC seal of approval on when they go to market. But in terms of more specifics, Terry's mentioned a few there, it's important to remember that it's the research, right? Research and scientific focus of this is what's going to differentiate this suite of products, again, from the clutter and the noise in the marketplace that's there. So that research will dictate the product types, forms, and everything else that will come out, of the market in time.
Last question.
No, just one quick one from me. I guess I'm curious about the distribution and generally for the study on this. Are these products something that will be distributed to UFC athletes when they're at events and things like that, or is that more just it'll be at the PI for free if you want to come by and try them, that type of thing?
Well, we want to have the studies completed first before we start throwing it on all the shelves. Certainly that would be our preference, that the athletes have ultimate access to it after the testing has been proven and completed. For sure.
I guess I meant for studies themselves.
To say, with respect to the research, obviously the first thing we've got to consider is the regulatory requirements in different states. So we'll begin with North America, and we're obviously going to navigate around the regulatory requirements for that. Yes, product to participate in the research, you're going to need the product. That will be held in Las Vegas, either at the Aurora facility, the Performance Institute, and it will be distributed for participants that will be in the research with very clear mandate and controls around usage and how they engaging with the research methodology. So that's the plan. And as we coming back to the previous question around, we've got a global roster now. We've got global roster. We also know that the usage is happening globally. But to begin with, the initial work on the research will be in the USA.
Last question, apologies if this already been answered, but do you have a timeline of how long you expect that initial phase of the research to last?
We anticipate in early 2020 we'll have our initial insights that will then start to feed into Aurora's development of products and the manufacturing of very specific approaches to delivery. So I think in early 2020 that's our ambition, to be in a position to have canvassed our participants in the research to then start to move to the second phase of the product development, because again, that's kind of the iterations that we're going to be working to.
I want to add, this isn't the only study Aurora is involved with. We have 80,000 patients in Canada, of which Jason has been monitoring 25,000 of them with respect to the effects of the medicine of cannabis. So that information comes to us as a bonus to the UFC, as you will. There's been a lot of work already done with respect to this molecule.
Okay, thank you everyone. Now I'm going to break for photos and interviews.